Welcome to Sketchy. We take all the super complex stuff you need to learn and turn them into memorable visual stories packed full of everything you need to know on test day. Click the link in the corner or description to try for free for 7 days. Now let's get to it. Welcome to part 2 on our series of chronic heart failure. In this lesson, we'll cover important elements of the H&P you should keep in mind when you're worried about heart failure. One of the most interesting and frustrating features of heart failure is that there are so many different etiologies. When you suspect heart failure in your patient, be ready to ask about a bunch of potential causes. Fortunately, we at Sketchy are ready to give you a hand. Let's start with the conditions classically associated with systolic dysfunction. Once again, remember that virtually every condition associated with systolic dysfunction can also cause diastolic dysfunction, and vice versa. These categories are really to help you separate out the most common causes of each type of heart failure. By far the most common cause of heart failure with reduced EF is ischemic heart disease, represented by the black heart pendant on this merman band leader. This includes acute MI, represented by our recurring Sketchy symbol, the broken heartstring on that heart-shaped guitar, and long-standing coronary artery disease, represented by his red coronary crown filled with that puffy yellow cap. Anywho, regardless of the specific cause, ischemic heart disease impairs the ventricle's ability to squeeze that blood out. Hence, heart failure with reduced ejection fraction. After ischemic heart disease, dilated cardiomyopathy is the next leading cause of heart failure with reduced EF. At Sketchy, dilated cardiomyopathy is represented by a big red dilated heart bag, just like the body of this red dilated jellyfish, being used as a cello? Wow, they're creative or sick down here under the sea. I don't know which it is. For all the details about dilated and other types of cardiomyopathy, check out our cardiomyopathy sketch later on in this chapter.